Hello, everybody. I'm Dr. John Stracks. Super excited to be with you this evening. I'm a physician who has a TMS practice located in Chicago, Illinois. I'm here with my colleague, Jessica Dixon, who I'll introduce a bit more shortly. Many of you know me, have heard me speak either live or in podcasts. And for those of you who don't know me, let me just introduce myself very briefly. I learned about TMS many, many years ago when I suffered through my own health issues that lasted almost a year. And I finally solved them by reading one of Dr. John Starnow's books and understanding the connection between stress and pain. And if you haven't heard or listened already, you can hear about that in pretty great detail on a podcast I did with Laura on Like Mind, Like Body from the summer of 2017. And after I learned about this connection between stress and pain, I then went to medical school from there. This was in the early 2000s, and I was 31 years old at the time. And I got to medical school with this knowledge about the connection between stress and non-physical causes and physical symptoms, and thought I would just tell everybody about what this is and how it works. And it turned out it wasn't quite that simple, but I have kept at it for the past 20 years, including going out to New York City and working with Dr. John Sarno when he was alive and practicing, and have increased my knowledge about mind-body medicine and TMS and PPD, and have continued to strengthen my practice in that over the years. And so just a note about terminology. I first learned about this from Dr. John Sarno, as I said, and so I use his term tension myositis syndrome or TMS, but that doesn't mean that I don't acknowledge the other terms, mind-body medicine, PPD. And so you'll hear me use that term this evening and just in Chicago that has, for the time being, moved to all telehealth. And that's okay, but I prefer to see people in person if I at all can. Interestingly, the relaxation in telehealth law has allowed me to start to see people and patients who I wouldn't have otherwise been able to consult with. And so that's been a nice benefit of changing the model a little bit. I'm also a medical advisor for Curable, and was actually there at the birth of Curable. I was having breakfast one morning with John and Laura and Eric, who were kicking around various ideas for what they might do. And they had had some experience with my practice and the groups that I run. And one of them asked, hey, like, what happens after you run your groups? Like, what do people do next? And I said, well, I don't have anything formal, but sometimes people will email me over the course of the day and say, like, I don't know, I'm doing great, and then I'm having this flare up. What should I do? And I said, so they email me. I email back. I was like, what's going on? Like, what happened yesterday? What's going on today? What's going to happen tomorrow? And then I'll get an email back from them in an hour saying, oh, thanks so much. I so appreciate that. And John said to me, like, Dr. Stracks, like, we don't need you to do that. We can have a bot do that. And so that's one of the ways that Curable got started, and really a number of years ago. And they've done amazing work in building up knowledge about this and treatments and how this works. And I tell them frequently that I think that Clara is a much more compassionate physician than 95% of the physicians who I actually know. And so in some sense, they're right. She can do it just as well as I can. So many of you also know, if you've listened to my podcast or if you've heard me talk before, I left my big hospital position in Chicago in late 2017 to set up my own practice, in a big part to focus more on TMS work. And I immediately grew the TMS portion of what I did from 2% to 20%, literally overnight, and then grew that to about 33%, which is where it was when COVID happened. And for better or for worse, now it's about 50% of what I do. I do individual consultations in person, now online. I have some of my own classes and discussion groups that I run. I'm a frequent guest on curables discussion groups, and occasionally do public events like this one. When I'm not doing TMS work, I do a fair amount of endocrinology. I do some primary care with my patients who like my holistic approach. I work with people who are looking for general, more integrative consultations on their health. And oftentimes that includes introductions to TMS when I hear what people are suffering with over a long time period. Because of the primary care component of what I do, I started following the COVID news early on, probably in early to mid February, and we started pushing out our newsletter with as much information as we could about what we were learning. All of that is now available on our website, www.drstracks.com. You're more than welcome to check out the information that we have. But because we were there early on trying to sort this out, we've accumulated a fair amount of knowledge about coronavirus and COVID at this point. I'll talk about that in just a minute. One of the things that I noticed, interestingly, is when this first started sometime in February, I woke up one morning out of a dream and it was clear to me coming out of that the coronavirus feeds on fear. And the calmer that we could be and the more we could manage our fear, I was convinced at the time, and I'm still convinced, the safer that we all will be. And so that's one of the ways that Jessica and I ended up here today, is that part of my thought after that was, what can I do on a regular basis that will help to keep people calm, help to calm the fear? And so we've done a few meditation nights together. And so we're here tonight to give out some more information, tell some stories, and talk a little bit more about what we know can be helpful for TMS in general, for calming ourselves during this time more specifically. So before I turn it over to Jessica, let me say just a few words about COVID, which seems relevant at the time. We've been following it since there were first signs here in the United States and pushing out the information. We've set up a monitoring system for our patients. And so if we think that they are ill, we call them or message them or video with them every day until they're better, or we think they're healed enough that they don't need that kind of intense monitoring anymore. And so some things that I've noticed, everybody in our practice has done well so far. There's been no hospitalizations, no intubations, no ventilators, no deaths. And that was our goal at the beginning. We wanted to have a mortality rate of 0%, which we currently have. 2 of our patients have been pretty sick with cough and shortness of breath. One of them is clearly improving. One of them I've been talking with over the course of the day. She finally went into the emergency room today. I just checked on her, and everything's coming up normal. So everybody is actually doing quite well, which starting to reassure me that people who are more or less healthy, not in every single occasion, but most of the time, even if they got the virus, people are doing well through it. And I think that's important information for people to know. Also, everybody is stressed about the virus, about the economy, about what's going on. The cumulative level of stress is higher than I have ever seen it in my lifetime, higher than September 11, higher than anything else that I have seen. And so my patients who are sensitive, which essentially in my practice is everybody, are really picking up on the cumulative stress and so can feel it even when they themselves aren't particularly stressed. I have a lot of patients who say to me, like, they're not even that worried about the virus. They're confident that if they got it, their family got it, they would be okay. But still, they're tapping into this collective stress that that is overwhelming for everybody. And so because the stress is so overwhelming, my TMS patients are having flare-ups. They're having back issues, and migraine headaches are worse, and skin issues are popping up. And like, I threw out my back this morning getting out of a car. Getting out of a car is just not that dangerous, but there it is. And so we don't even always know where these flare-ups are coming from, but they're coming. And just today I was talking with the patients, we decided we're going to call them COVID flares. Like, they're more or less meaningless in terms of how you function on a physical basis, but they're happening to everybody, and they're happening regularly. Now, my non-TMS patients, of which I have, it's over half my practice, they are a mess. They are calling me constantly, flat on their back, in their bedroom, unable to move, and having no idea what to do. And so it's not just people with TMS who are having flares, it is everybody. And my non-TMS patients are much worse off than my TMS patients are. And so two characteristics that I've noticed that have been particularly helpful in managing during this time. One has been acknowledging and knowing and expressing emotions that we talk about regularly in the TMS world, but just being able to know that we're having feelings about the situation has been incredibly helpful. Our 12-year-old, who may be watching, if you are, hi Harrison, had a migraine on Monday. And so I made him write down everything he was stressed about, which he said nothing, and everything he was mad about, which led with coronavirus and all the downstream effects on that. And so writing it down didn't change anything. It didn't make it better. It didn't make school magically come back into real life. But as far as I could tell, his migraine got a lot better. And so it morphed from the physical component of it into the anger that was underneath. And he got better, at least for now. And so just acknowledging that the feelings are there is such an important part of managing during this time, even when we can't change anything and there's not the predictability that we want. Another trait that I've noticed been particularly helpful, interestingly, is introversion. My patients who are introverts have been so much better off than my patients who are extroverts. And a number of them have said to me, like, they feel like they've been practicing for this for decades. Like, they like being alone. They like being by themselves. They like being able to say, like, oh, I'd love to come over for dinner, but I can't, I'm sorry. One of my patients this morning said that she sort of thinks she'll kind of miss that excuse when the lockdown is over. And so just lastly on that note, like, we're all doing the best that we can to get through this. It's upsetting, it's disorienting, it's uncertain. I know that some of my patients, some of you probably have lost jobs or are furloughed. And so there's a lot of uncertainty out there, and we're all trying to do our best to go through it. I have also seen some amazing things happen in terms of people taking care of each other and reaching out. And I was talking to one of my patients just an hour ago who has been recording herself reading children's books on YouTube and then sending them out to her preschool class. And so that wasn't enough. Today, she drove around on field trips to every one of her students' house and waved to them from her car. And so these, like, seriously, these heroic efforts that people are making to try to make some sense and to try to make some meaning out of what's going on. And so, as I said at the beginning, this is where Jessica and I started with this. What can we do? What can we do to help? And getting information out, telling people what we know, teaching about meditation and relaxation. And I think more than anything else, being together in community is why we're trying to do this in as many places and as often as we can. And so in a second, I'm going to have Jessica tell a little bit of a story, talk a little bit about some of the work that she does as a mindfulness and mindful self-compassion instructor. If there's time, we'll try to answer a few questions for you. We'll continue to work with Curable to provide as many opportunities to connect as we possibly can. And so with that, I'm going to turn it over to Jessica, who's been a friend and colleague for a number of years now, is talented, as I said, mindfulness and mindful self-compassion instructor, has had a tremendous recovery from migraine headaches over the last, I don't know, 5 years, 6 years, maybe 7 years. It's been a while, but she will tell you a little bit about that and a little bit about what she does. She's also an instructor for Curable and has run Curable groups, maybe doing that as currently, as far as I know. And Jessica, thrilled that you're here tonight with me to talk about this and have been with me the last couple of weeks as we've done some of this for my patients as well. So thanks for being here.
Thank you so much. It's an honor to be here with all of you virtually and be connected in this community right now. I'm excited to share some of my story, which is one of recovery from migraines and really a number of other TMS or mind-body symptoms. When I was on my kind of recovery journey, hearing other people's stories was one of the things that I think really helped me to understand how my mind and body were connected, not feel alone, and also feel hopeful as I listened to how other people worked through this on their journey. It gave me more of a path. So I hope that sharing my story tonight can do a little bit of that. And then want to spend some time at the end focused on self-compassion, which kind of self-compassion and mindfulness meditation are big passions of mine coming through this journey because they've been so helpful for me in recovering from some of the chronic pain and TMS symptoms that I've had. So going on a journey back, first big migraine for me was around 12. And they came and went through a lot of my life. Looking back now, I can see that during periods of my life that were really high stress, graduate school, some of my first jobs as a manager, they got a lot worse and eased at times too. And I also had a number of other kind of interesting body things that I now look back and think about as TMS show up. So some real knee pain, patellofemoral syndrome issues in high school that just went away. I had a really itchy scalp for a lot of years that just went away. Low back pain issues. I was doing PT for that. Shoulder pain issues. I used to get rashes when I ran. I would have a bunch of seasonal allergies. I was on a few different medications for seasonal allergies, TMJ, chronic kind of flu, colds, heartburn, a thyroid issue, just a lot, and sort of a cluster of things that just didn't always totally make sense to me. But really migraines like took center stage as the most challenging thing. And I went on this rigorous search for triggers. I looked before talking tonight, I looked at my old trigger tracker, and I was tracking 37 variables that might potentially be a trigger for me. The exact milligrams of caffeine I had, how many hours of sleep I had, how many glasses of water, whether I had exercise, whether I had red wine, every food that I ate, so many different things. I've had my brother, who was sort of a major mathematician at one point, ran a regression analysis on the relationship between barometric pressure and my migraines, because I was convinced that storms were the problem. So really a deep and exhaustive search that was very fear-based. Like, if I can just figure it out and control it, like that's what's gonna cure this for me. I also was being treated with a lot of different medications, ran through a lot of doctors, as I'm sure many of you have for your different symptoms. For those of my fellow migraine friends out there in the world, I'll give you a quick list of all of the medications that I was taking for migraines at different points. Nortriptyline, Topamax, gabapentin, ketoprofen, Midrin, Relpax, Toradol, ibuprofen. That was my real go-to, ibuprofen. Maxalt, prednisone, Aleve. I tried, uh, what's it called, Dr. Stracks, where they,
Botox?
tried Botox. It wasn't even fun Botox, like not in like wrinkle areas of the face. It's like here and here. Didn't work, didn't do anything. Tried so many things, biofeedback therapy, yoga. Some of those things were very helpful actually, but I think now about, I've heard Nicole Sachs, a pain psychologist, talk about how we can do things from an energy of love or do things from an energy of fear. And a lot of the things that I was doing were actually helpful. Massage is great, you know, therapy is wonderful. But when I was doing it from this energy of fear of, if I don't get this massage, I need this person to fix me. You know, I'm gonna have terrible chronic pain. My migraine's gonna come back. I have to look outside of myself for the answer to this, and I need someone else to fix this. Very kind of fear-based energy, and just not as helpful as now. I still do some of those things. I love yoga. I love my therapist. I love getting a massage, but it's from this energy of love. Like, oh, you know, if I've had a tough week, what feels better than a great massage? So tried a lot of different stuff. It didn't really help. Eventually landed at Dr. Strack's office, 6 or 7 years ago. And he helped me start to see and understand these ideas, these concepts that Curable teaches about how our minds and bodies are connected, how things like the boundaries that we have in place, childhood stressors, inner criticism, perfectionism, how all of those things can show up in our body as pain. And I was able in my journey to kind of look back and see now more clearly what some of the kind of root causes, I think, for my pain, my migraines, and some of these other issues sort of showing up in my body were. And I think one of them is just, I think I came out a very sensitive person. I definitely identify as sort of a highly sensitive person. And I think my home environment and things that were happening in it increased that sensitivity. It became almost adaptive for me to be really aware of what other people's feelings were and what was happening, just to feel safe, to feel good. I also identify as an empath, as somebody who can feel almost like a superpower or a burden at times, can feel other people's feelings as if they're my own in my body. And so when I didn't understand this and how it worked and really didn't have any boundaries around it, it was almost debilitating at times. How if someone around me was really angry or really sad or upset, it was like I couldn't even separate it from my own experience. I would feel it in my body. And then those things kind of coupled with just some stuff that was happening in my family, a very loving family. I'm grateful for my family, a family with a lot of privilege and resources. But my mom was just really struggled with depression, pretty bad depression as we were growing up. And it was untreated. And, you know, that was a challenge. And I did a lot of emotional caretaking of my mom. One of my brothers, on the autism spectrum and had a lot of issues with interacting socially with people, with anger, with addiction that started in middle school and sort of as a continued challenge for him today. And so navigating things with my brother and wanting to be the perfect child, very people pleasing. Let me take care of my mom. I've got to get straight A's in school and be perfect. I don't want to. My parents are working a lot with my brother who's got some of these special needs. I don't need to be an extra issue on their plate. And I think that influenced a little bit how some of that perfectionism and people pleasing showed up for me. And also some, not sexual abuse, but some pretty confusing sexual boundaries in my household with my dad, which was something that I felt like a secret or felt like something I was very ashamed of and felt private to me, and not like something I could talk about. And I kind of carried as a deep sort of shameful wound while also not clearly kind of being bad enough that I could point to it and be like, I know this is wrong. So sort of feeling like that was my fault and my kind of secret burden to carry, which having learned a lot more about secrets and how we carry them. I understand how that could kind of show up in my body too as pain.
Yeah.
I think kind of embedded in that was also difficulty expressing anger and being assertive and setting boundaries. All of that kind of comes along with some of that people pleasing. So I think some of those things were sort of root causes. And in my journey to heal, it was a lot about coming to love and accept myself, set better boundaries, really bringing in meditation and mindfulness, which helped me to quiet myself enough that feelings that were below the surface, sort of below the line of my awareness, issues that were deeper down there, could come up and be welcome and be held in kindness. And so that work for me involved a lot of journaling, a lot of meditation, group support, similar to the curable groups. Dr. Stracks runs groups like that really impacted my healing. For me, maybe not for everybody, doesn't necessarily need this, but therapy to unwind some of those issues. And I've had people ask, like, do you actually have to fix all of this stuff to start to feel better? Interestingly, for me, no. I mean, eventually, over these years, I've been able to work through a lot in these relationships and change some of the dynamics. But even just having the awareness for me that there was not something physically wrong with my body, that sort of personality characteristics and past stressors and current stressors could show up as pain, could manifest as physical symptoms, and that there's a way to turn towards them, look at them, almost dialogue with my symptoms, to be able to kind of hear and understand what needed to be held, what needed to come to the surface and be met with compassion, really helped me to recover. And so to me, recovery doesn't mean that I've never, it's been 6 years, I've never had a headache or migraine. Nope, I had a really bad one last week. It was just a COVID flare, like it's fine, but it happens. But I don't remember the exact quote, but Dr. Howard Schubiner, I wrote a quote by him about recovery and what recovery means. And it's the essence of it was, you don't have the fear around the symptoms. I mean, for me, the symptoms decreased dramatically. Like I started to have some relief moving through the groups process and journaling and doing that work. And maybe a year out, was down to, I started at, 15 or more headache days, migraine days a month, and was down to maybe I'd have one a month or something like that. So it was a pretty dramatic recovery for me. But more than even just the pain, for me, the recovery was about, if I get a headache today, if I get a migraine today, the experience of it is so different. The suffering around it is so much less, because while the physical pain may be the same, the fear, the gripping, the obsession, the self-criticism around it is not there in the same way. And there's a deep sort of resilience that you can feel in sort of getting to that place. And so that's certainly what I wish for everybody on this call tonight. And I think these tools are what got me here. So it's the stuff that Curable teaches. It's the stuff that Dr. Stracks teaches.
Yeah, I frequently will say to people that the pain itself oftentimes isn't the problem. I mean, we assume it's the problem because we're Americans and that's how we think about pain. But oftentimes the pain points the way to the problem. And so I think that's one of the things that you're describing, is that, yes, you had the migraines. Yes, they were terrible. But ultimately, you were able to use the migraines to figure out what needed to be healed, the self-criticism and some family dynamics and job situation. And so now I think what I hear you saying, what I've heard you say before, is that when you get a migraine, you don't necessarily think of it, or maybe don't think of it at this point, as the problem, but it frequently points the way to the
Yeah,
problem for
it's
you.
having a symptom like that show up is to me a cue to get really curious. Like, oh, interesting. Let me journal. Let me meditate. Let me sit with this and see. There's something there. There may be something underneath here that really needs attention. And
Mhm.
for me, part of it right now is like, oh, we're collectively in the world holding a lot. Even if we're lucky enough that our individual circumstances are pretty good right now.
Mhm.
The collective holding, and especially as someone who absorbs feelings of other people very easily, the collective holding of the fear and the grief, the anger that's in the world right now is maybe enough. But individually, kind of pre-COVID, I would say, yeah, it's like it just points a light to what needs exploration inside of me.
Mhm. Yeah.
And so confusing or sort of counterintuitively, there's gratitude for having really gone through this very painful, physically painful journey, 20 years of migraines, because it helped me to uncover what really um, what really needed my attention and kindness, which more than anything else was just loving myself, establishing different boundaries, taking better care of myself, and not speaking to myself. I used to speak to myself in a way I would never speak to anybody else. The voice inside my head was really, really tough. And that voice is still there sometimes too, but I just can see it more easily and take it less personally, replace it
Mhm.
with some of this self-compassion.
Yeah. I think it's hard when people are just getting started with this to sort of have this framework of like, how could you be grateful for the pain? And yet I've heard so many people say that over the years that they just, and me too, like I wouldn't trade these experiences for anything because for me personally, like it's just put me in places that I would have had no idea how to get to without having had those experiences. And so I know how disconcerting that sounds when people are just starting to work on that. And just, dozens of times I've heard people say that they're ultimately grateful for having had the experience because it teaches them things that probably wouldn't have learned any other way.
Yeah, and I don't mean that to come across insensitively to
Yeah,
anybody.
no, yeah,
Is pain is really it's really
it's really
hard.
hard.
I was very reminded of that with my migraine last week.
Yeah.
But it can be an invitation. Our natural response in life as humans when things are really hard, really uncomfortable, emotionally or physically, is to like turn and try to sprint the other direction, to resist, try to fix it immediately.
Hmm.
And if there's a seed to plant here, I think it's the invitation to turn towards, counterintuitive, both to the emotion, the physical pain and the emotional pain, to look more directly at it, can be scary in itself, but is deeply powerful. Even for the physical pain, just to color that more. Last week, terrible migraine on Sunday. Went to bed at like 2 o'clock, and nothing was kind of working. And just closed my eyes and was just like, and sometimes pain is too much to do this. So I'm not suggesting this is the right move all of the time. Sometimes we just need to resource, put on Netflix, whatever brings you comfort in that moment. But I was sort of in the place where I was like, let me just sit with this. Let me turn and be with this and feel all of the sensations of it, and just kind of kindly, quietly be here with these physical sensations. And it intensified a little bit at first and then dropped back, and there's like a kind of dance of the sensation. But then I mean, the impact of doing something like that, I think, is it ultimately decreases some of my fear of a migraine coming back. It's like I can be with this, I can kind of sit with this, and I can see that it's more dynamic. And it's the same, it can be the same with emotion. So that deep physical, I point to my chest because that's often where I feel grief or anxiety. And when we turn and are just sit with it, if we can, if it's not going to overwhelm us or flood us too much, when we just sit with it, again, it'll kind of blossom and settle, and it just gives us that sense of strength of like, I don't have to be quite as afraid of this. I can be with this. I can let this be here from a place of holding, from a place of being bigger than it.
Yeah, and so many of us, me included, like our emotions are scary, and I don't want to sit with my emotions. I don't want to have the emotions. And yet, like if when they're that scary, oftentimes the physical pain is less scary, which is what it's doing there. And so as we get better at this, as we recognize what it's going on, we can start to tap into those emotions, and the more we can feel them, the less we have to feel it in these physical ways. That's what my son noticed on Monday, that like the migraine was one thing, but feeling the anger of this like huge issue of coronavirus, while not fun, was enough to take the migraine itself away.
Yeah, absolutely. I think something else that can be really helpful, which leads us a little bit into talking more about self-compassion, a little exercise I'd like to do with everybody, is we know, as they, as is taught in the curable program, when we get into a chronic state of fear, that fight, flight, freeze, adrenaline response, when it's not just for an acute situation that's here and it goes away, when it's kind of all the time, which the environment we're living in right now with the pandemic can do this, that sort of danger system being on in the body can lead to pain, right? When our nervous system is sort of in this hyper state of arousal. And so one of the tools that I think can be particularly helpful with kind of calming the nervous system back down is working with self-compassion. And so I want to teach a really short, simple practice. It comes from the work of Kristen Neff and Christopher Germer, who are PhD researchers, self-compassion researchers. And I think it can be incredibly effective, because one of the things that can be sort of upstream from the danger system turning on is our inner critic. So when our inner critic voice gets really loud, that can also turn the danger system on. Self-compassion is a beautiful antidote, a beautiful practice to start to retrain our brains to, when something difficult happens, I respond to myself with kindness, versus many of our natural sort of training and patterning of something difficult happens, I find my accountability and beat myself up for it in kind of a nasty way. So compassion for ourselves is really much like compassion for someone else. We have to see that there's suffering present. We have to care, extend some kind of care and kindness through our words or actions. And so that's what we work with, kind of bringing to ourselves in this little exercise. So I'd love to invite you. I'm going to sit up like I'm meditating and close my eyes. And you at home can do the same if that feels good to you. Maybe just start by breathing. Feeling your feet flat on the ground. Feeling the sensation of the chair underneath you. Feeling a sense of connection to the earth. You might even deepen your breath for a few cycles, for a longer inhale and a long extended exhale. And I just want to invite you to bring to mind something that's been difficult for you today, this week. You might not choose something that's going to make you feel way too overwhelmed. but something that has some moderate sting to it that's been hard. If there's a memory associated with it, you might go there in your mind. Picture what exactly was happening in the most difficult moment of it. In the first step of the self-compassion break, we simply notice the suffering that's present. So I want to invite you to do that by scanning in your body for any physical sensations, particularly of emotions that might be present. Commonly, feeling of tightness in the chest or weight on the chest, unease in the belly, constriction in the throat, tension in the jaw or shoulders. Just being with those sensations. And then working with labeling any emotions that are present. If you're aware of anxiety, sadness, grief, anger, shame, just labeling them. Or if you're not sure, but you feel some emotions, you might just say confusing emotions or big emotions. In the next step, we connect with our common humanity. We remember we're not alone in this. When the difficult emotions come up, it's easy to judge ourselves or feel isolated. Here we take a moment to remember that any emotion that I've just named, any emotion you might be feeling, it's not unique to you. It's part of the human experience. You might even extend permission for the emotion to be there. Or say something like, okay, this belongs. This fear belongs. Sadness belongs. This frustration belongs. There's nothing wrong with me for having these feelings. These feelings come with having a body. They're part of being human. And I'm not alone. In the last stage, we extend kindness to ourselves in this difficult moment. I invite you to put your hand on your heart. Feel the tenderness of that care. And imagine what you might say to somebody struggling with the same issue. What kind words would you offer to them? Maybe this is really hard and I'm so sorry. Or I see how this is hurting you and I really care. If you're struggling with self-criticism, you might say, there's nothing you could ever do or not do that would let me stop loving you. Or if the issue is around fear or uncertainty, you might say, I'm never going to leave you. We don't know how this is going to unfold, but I'm going to be with you every step of the way. I will always be here with you. And now taking a moment to just notice if there's been any shift in the body. If the squeeze of whatever emotion was there relaxed a little bit, softened, if there's any sense of expansion around it, like you are the holder of this, not fused with it. And sometimes it takes many rounds of this to start to get that sense of expansion. So it doesn't mean you're doing it wrong if you don't have that right now. When you're ready, close this short practice and you can open your eyes again. And I'll just say that for many of us, this kind of practice is very different from what we've been really kind of practicing our whole lives inside of our heads. And so it can feel really awkward to say those things to yourself. It can feel funny. It can feel like this, I don't believe that. And in my experience, it helps to find language that works for you, even if it's just an acknowledgement of the suffering, like, ouch, this hurts. But keep practicing with it. If you imagine all of the times you've said something critical to yourself in your mind, it takes a lot of practice to start to change that patterning. But the beautiful thing is the neuroplasticity of our brains means that we can change it. We can lay down new pathways in the brain so that when something tough happens, we meet ourselves with kindness.
Do you have any examples of where this has been particularly helpful for you? I've got one. I want to see if you do also.
Yeah, one that comes to mind is, my husband and I struggled to get pregnant for a couple of years and went on an IVF journey. For any of you who have experienced it, IVF is not for the unmotivated. It's a challenging process, an emotional process. And then you add extra hormones and it's an even more emotional process. For months there, I was giving myself up to 5 injections a day, and it was hard. I mean, it was really hard. And a lot came up, very commonly for women struggling with fertility. Some of those inner critical thought, why can't my body do this? This is what women are supposed to do. Am I broken? There's a lot that can come up. And working with replacing that, I had a routine. I mean, I worked a lot with that just formally in my meditations, but anytime before I would give myself a shot, or before my husband would give me a shot, it was like taking a deep breath and saying, I love you, darling. Thank you for doing this. Something so simple, but it totally changed the experience of the physical pain of the shot and the emotional pain of what I was going through, and reworked the inner criticism that could have been there and really blossomed if I had let it. So yeah, that's one way.
Yeah, I actually learned about self-compassion as an adult. Like, I learned about it in the last 10 years and didn't have a framework for it previously. And so I first learned more about it. I took a couple levels of psychotherapy training, and there's one of the topics that we covered. And so I was doing the training in Minnesota from here in Chicago, and I was like checking my schedule at work. It's probably 6 or 7 years ago. And I noticed that I had a full schedule for a day that I was supposed to be at this training in Minneapolis. And so interestingly, I immediately tried to blame my staff. I was like, I told you to clear my schedule. And they're like, no. Like, they showed me the email. So bad. And so then I started blaming myself. Like, I was like, oh my God, like professionals don't do this. How could I be so stupid? Like, I knew this was happening months ago. How could I do this? And I was just like sitting there in the middle of the workday, like screaming at myself. And I'd learned enough. And I was like, wait. We don't talk like that in here anymore. Like, this is not how it happens. And like, it calmed down, and I took a couple deep breaths, and it immediately was clear to me like how to fix it. I was going to be off on Monday because I was going to be there on Friday. So I opened my schedule. Like, my staff called some people. I called some people. People I called are like, oh my God, Dr. Stracks, you reached out. Like, that's so nice of you to reach out and change it. And everybody was fine. But without the recognition of the self-compassion, like, that could have gone on for who knows how long, and then end up in whatever, back pain, migraine, headache, just being in a bad mood at the end of the day. And so it can make such a difference. And I think you're right. Like, it's so unnatural for us to like say, stop. Like, if you don't have anything nice to say, there's no reason to say it.
I love your, we don't talk like that around here. I know you say that to patients too. If they come in and start beating themselves up, you're like, hey, we don't talk like that.
That's not acceptable in my office.
And my husband Bill and I have adopted that with, if one of us is like, oh, how could I be so stupid? If one of us like gets on ourselves, like, hey, we don't talk like that in our family. Like, that's our, pulled that right in. It's great. Sometimes we need a reminder too, outside of ourselves.
Yeah. I know there are a couple of questions that have come in the Facebook chat. I'm going to read those in a second. Any last thoughts, Jessica, about migraines or self-compassion or TMS in general?
I just want to reinforce what you shared at the beginning about coronavirus and COVID flares, as I love that you've named it. As I work one-on-one with coaching clients, kind of focused on mindfulness and meditation stuff over Zoom, and sort of specialize with a lot of folks who given my own journey, who have chronic pain, and kind of working on these different skills with them. And everybody's flared right now. I don't think I have a single client who's not flared right now. And commonly the response to that for people too has been like, why am I so flared? Like, what's wrong with me? What am I doing? It's like, no, everybody's flared right now. Like, it's okay. Like, what if this is part of, I love your message about your TMS patients are doing better. We have more tools, this work. You have these tools that help us to see that. And I just encourage you to make sure that self-compassion is one of those tools in it. And just want to normalize. That's just something that this may be part of the process of how our bodies work through what's happening in the world right now, because it's really big. But it doesn't mean it's gonna last forever for folks.
Yeah, no, that's a really good point. I say to people regularly that mourning, MOURNING, can't really happen, and oftentimes without a physical component. And so I know that if somebody's spouse dies, or close relative, or parents, like, they get sick, everybody gets sick, and there's just not a way to get through that without it. It's the physical is part of the process. And I think this may be something similar, like just having our bodies express. It's too big to be expressed in just words. And so our bodies will help us with that. Yeah.
And so particularly for people who are real early in your journey of working with this stuff, I encourage you to be patient with it too, because this is just a little bit more of a challenging time to kind of use these tools are the right tools. I really believe that, but it could take a little bit of extra time right here in the beginning, which might be hard to hear. And those of you who are further along in a recovery journey, again, if you're having a setback, it's normal. It's okay.
Yeah. So anyway, we've got time for a couple of questions. I know a couple had come in. They're addressed to me, but Jessica, if you have insights on them, feel free to chime in. And so first one says, what about nervous system and heart regulation or neuropathic pain? Do you ever work on the mindfulness and self-compassion in terms of, say, like heart rhythm or autonomic regulation?
I have some clients who have severe anxiety and panic attack, which sometimes, they have some of those symptoms, and these tools I think are helpful for that, but
Mhm.
probably not as much as you have.
Yeah. And so, I have a workbook that goes along with my class, and one of the things I talk about is belief, that this is not a faith-based cure, but you can't believe 0% that it's going to be helpful. One of the examples I use actually for me is heart palpitations, which are clearly an autonomic nervous system issue, and I get them fairly regularly. I've had them checked out. Last time I saw my friend, the cardiologist, she literally said to me, like, you have been touched with the wand of heart palpitations. Like that's the conventional medicine's response to it. Um, but it clearly is worse on stressful days. It's clearly, interestingly, worse on days when I'm harder on myself. And so most of you who are listening who are my patients know that I can run behind in my clinic. And so on days, especially back at the hospital where they were super busy, like the further late I would run, the more I could feel myself tensing and that happening. And so being kind and mindful and slowing down and listening to our heart, all of that, I think, is exceedingly helpful in calming down some of those autonomic system issues. And I think neuropathic pain is very similar. I don't usually like disqualify types of pain from responding to these types of treatments. It's all about how these nervous system pathways get ingrained in our body and all these tools that we've learned about how to calm those down. And so I've seen plenty of patients with neuropathic pain who have used the various TMS tools to really make a huge difference in how they feel. Um, the let's see, a question came in about eating disorders, interestingly, and whether it can be an equivalent of pain. And this is interesting. I have a group that I work with on a regular basis, and we were talking about this on Monday night. I've been doing some research about perfectionism because perfectionism is such a common trait that people associate with pain. And one of the things I picked up in doing that research is perfectionism is clearly associated with eating disorders, interestingly, depression, anxiety, eating disorders, fibromyalgia as well. And that perfectionism may not be a direct cause of symptoms, interestingly. And I do think that perfectionism leads to self-criticism, which is a cause. But I was reading that perfectionism may be a signal that there are emotions going on underneath, much like the pain is. And so what I've been encouraging people to do, and what this reading encouraged people to do, is when they feel themselves acting perfectionistically or like feeling the need to tidy it up or redo it, to stop and take a breath and look for the emotion underneath the surface. And so I think I've known this about eating disorders, and I think this reinforces it, that when we feel like we want to binge or purge, that oftentimes it's a cover up for an emotion that's underneath. And so as we were just talking about, a lot of times those emotions are way scarier than the symptoms that we're dealing with, but it really oftentimes, I think, gets to the root of what's going on. So I recognize it's 6 o'clock. I'm going to keep people just a couple of minutes over. But one question about autoimmunity and inflammatory arthritis. And so I get that question asked a lot. And a couple of things I want to highlight about autoimmune disease. And Jessica, feel free to chime in if you want. But if somebody comes into my office and has an autoimmune disease, I don't normally say we're just going to treat it with TMS. And TMS is usually on the list of possible options. But I frequently, because of the nature of what I do, I may talk about diet and supplements and other options. as well. But I do think that there's a significant stress and interestingly trauma component to it. And so I frequently will recommend the book The Last Best Cure by Donna Jackson Nakazawa, about how trauma shows up in the immune system, and her excellent story about her own experience in calming down her autoimmune disease, and then what we've learned about the nature of trauma over time and how it gets into our bodies and will show up in our immune systems. And so I honestly think that we have a little bit more connection with our immune system than we would think. And so my patients who have bad autoimmune disease, one of the assignments that I frequently will give them is to visualize their immune system calming down and getting it the message that it doesn't have to be overactive anymore. It doesn't have to attack things it's not supposed to attack. Jessica, any thoughts, either professionally or personally, about autoimmunity?
Yeah, I think personally I can share some of my stories. I have a thyroid disease called Hashimoto's. Dr. Stracks treats it, and and we look at diet and we treat it with medication. But it's also, I will say I believe this for myself, and I can't point to science that would. I don't have evidence of this other than my own kind of beliefs and my experience. I just think it's very interesting. When I saw Dr. Stracks for the first time in January of 2014, I believe, we measured my kind of antibody response. So the way this thyroid condition works, you have antibodies to yourself. You're sort of attacking yourself, and my antibody level was like 800. Normal is like 5 or something, 10.
Yeah.
So that showed that I had this thyroid disease, which I was aware of. As I worked over these last 6 or 7 years on calming the voice, the inner critical voice, calming how much I was attacking myself inside my head, and really replacing that with like really rich self-compassion and kindness. I just think it's very interesting that my antibody levels, sort of not much else changed. My antibody levels cut more than in half, down to like 330, I think the last time we measured them. So I'm not suggesting that anyone who has autoimmune that you're causing that, or you're exacerbating it. But I do believe that we don't, and kind of conventional medicine does not understand all of the ways in which our minds and bodies are connected. And so to me, I sort of believe that the kinder I am to myself, the healthier my thyroid function is going to be.
Mm-hmm. Yeah, no, I totally believe that's true. Somebody I know just typed in, like, do you have to revisit the trauma to address the TMS? I don't necessarily prescribe that for people. I think there are good ways to treat trauma, and there's a lot of information out there these days about what works in healing trauma and what we know about trauma. I think a couple of thoughts, Donna Jackson in this excellent book, she makes a deal with her internist that she's going to do more yoga, more psychotherapy, more meditation, and I'm going to blank on the fourth. And more acupuncture, thank you. And she does those things, and just like so much better. And she doesn't, I don't think, talk in there about like revisiting the trauma, reworking it. And so, especially if you're trying to do it on your own, oftentimes you try to delve back into it, it can be re-traumatizing. And so I don't normally recommend that. Bessel van der Kolk's book on The Body Keeps the Score is an excellent resource for what really is helpful for healing trauma. There are a lot of good psychotherapists out there who work at the level of the body, somatic experiencing, sensory motor psychotherapy. They really believe, and this is some of the training that I had, that like you work at the level of the body so that the story doesn't have to be re-traumatizing again. And so I usually sort of have people work on other aspects of it rather than trying to relive it or to revisit it, especially if you're trying to work on it on your own. two more questions. One came in, waking up with symptoms in the morning. And so this is actually the question of the week. I've been asked this numerous times by people. And it's really hard, I think, to control what's going on when we're sleeping. And so we know that people will wake up with symptoms. We don't know exactly what's going on in the brain overnight that's causing people to stiffen up, or the pain pathway to flare, or for it to surface that way. But I think a couple of things. One, like, there's only so much control we have about what's happening overnight. And so if we wake up with symptoms, I think a lot of time the task is to be kind to ourselves as we wake up, not to be frustrated with the pain, not to be frustrated with ourselves. Occasionally I will wake up with a headache. I don't really get headaches anymore. I'll wake up with a headache, and it's really about like breathing, calming, and usually it's gone within 5 minutes or so. There may be some work that people can do on the way to bed that is helpful. And so figuring out, like, is there anything stressful going on, writing it down, putting it away, getting the stressful negative thoughts out of our heads, talking to ourselves on the way to bed, like, no reason for the pain to be there. We've got it covered. We're working on this. And so there may be things that we can do on that end, but I think a lot of it is being kind to ourselves, understanding that we don't have total control over what's going on in the middle of the night, and that just because the pain is surfacing in the morning, A, doesn't mean that we've done anything wrong, and then B, especially doesn't mean it's going to be there for very long. I definitely have patients who have the mantra that the first half an hour or first hour of the morning doesn't count. Like, they just don't worry about anything that's going on in their body as they're kind of waking up, getting the day started, getting loosened up. And so those are a couple of my thoughts at the moment about pain that shows up in the morning. And then last question about when there's a physical reason for the pain, like a tear. There's so many studies that are out there about MRIs and CT scans and how poorly they predict what's going on in our body. We know that because there's something that shows up on a CT doesn't mean that people are going to have pain. And so many people who are walking around with MRIs and CT scans that show like really dangerous looking images and are totally fine. Like, they were only got those because they were control subjects in studies. And so I don't assume that when there's a tear in cartilage or a tear in the disc, that it really means that pain is going to be there for sure. And so even if there are structural issues that get picked up on CT or MRI imaging, using these tools, practicing these strategies, learning about it, all of those will significantly help. And then if worse comes to worse, I say there's always a physical component, a psychological component, emotional component, a spiritual component. And if you work on the non-physical components, like say it's 50-50, like if you're 50% better, that would probably be a significant improvement. And oftentimes we find out it's much more than 50% better. So we're going to wrap up. Jessica, somebody had a question for you. Any good books or resources about migraines that you particularly like?
Yeah, there's none that come to mind that are targeted at migraines, but there were books that really helped me that were more about, for me, like what was underneath migraines, like the perfectionism, people pleasing, stressors kind of stuff. I second the two that Dr. Stracks has talked about. How do you say his name?
Bessel van der Kolk.
I was like, Bessel van der Kolk's The Body Keeps the Score, The Last Best Cure. And then Brene Brown's Gifts of Imperfection is like a treasured gem for me, with perfectionism. Tara Brach's Radical Acceptance, or she has a new one, Radical Compassion, Radical Compassion.
Yeah.
Great resources and tools, I think.
Yeah, and if you're patient, like we're working on it. And so Lee, if you're out there, we're working on a book on migraines for people, and so trying hard to get something out by the end of the year. So
yes, I was interviewed for that. Excited about that.
We're working on it. So anyways, we will wrap up here. Allison and the Curable team, thanks so much for having us on. If you have things that you would like to see over time, I am committed, and we are committed to providing as much information as we can. So let the Curable team know what would be helpful for you. Those of you who are asking if I'm available for consultation, absolutely, please get in touch with us. You can email me info@drstracks.com or go to my website, www.drstracks.com. And just send us a message and we will get back to you. We are happy to consult with people. The telehealth rules have been lowered while COVID is going on. And so I have the ability to work with people who I wouldn't necessarily have had the ability to work with. Jessica, how can people find you if they are interested?
Yeah, you can find my website. It's Jessica Dixon, Dixon, mindfulness.com. Or you can reach out. The Curable folks can connect you to me as well for to learn more about private coaching.
Yeah, I frequently will host some of my own question and answers, doing another one next week. Information is on our website. And like I said, if you have more that you want to hear through the Curable platform, I'll let them know, and we will do our best to oblige and be of service during this difficult time. So thanks for joining us. Thanks for staying 15 minutes late with us. Appreciate everybody who's brave enough to work on pain and symptoms in this way, taking these steps, finding Curable, listening to what we're saying, doing the reading. All that makes a difference. And so even when you don't feel like you're making progress, doing these things is helping you make progress. So good for you for being in here, and thanks for sharing the time with us tonight. So with that, we will sign off. It's been a pleasure to be here with you this evening. Thanks, Jessica. Thanks so much.
Be kind to yourselves. Thank you.
Be safe.